Hey guys, welcome back to the channel. My name's Sanchit, I'm a psychiatry trainee in the UK. We're missing Varun today, but he'll be back before you know it. So seeing as Varun isn't here, on this week's video, I'm going to be talking about what I love most about psychiatry. Before I get into it, the first distinction I want to make is I think in the UK, a lot of people like certain specialties, but get turned away by the way they're run in the NHS or something about working in the specialty in the NHS. So for this video, I'm going to split it up into two different parts. What I like about psychiatry, the specialty itself as a subject, and what I like about working as a psychiatrist here in the UK in the NHS. So starting off with what I love about psychiatry, the subject, and the first thing definitely has to be the patients themselves. One of the big privileges we have in psychiatry is the amount of time we get to spend with our patients. Unlike medical jobs or surgical jobs where you might spend 20 minutes maybe clerking in a patient and getting to know them, in psychiatry sometimes that can be 45 minutes, an hour, or even more, just really getting to know people and finding out exactly what's happened to them in their lives to bring them to the point that they're in now. With the amount of time you get to spend with patients, you really get to build up more of a rapport and a better relationship with your patients. It's such a privilege that patients can feel comfortable enough to talk to you about really traumatic events that potentially they've never spoken about before or have only spoken about to really close members of their family or friends. I think as a psychiatrist, or anyone working in mental health really, you're working with a lot of people who have been through incredibly tough things in their lives, things that you just wouldn't be able to imagine. And it's not always about fixing everything. Sometimes it's just about helping people make the best of what they can. And I think a large part of the job satisfaction I get is the impact I can make on people's lives who don't really have anywhere else to turn. Alongside the patients, I also find psychiatry, the subject matter, very, very interesting. Now, ever since I was young, I've always been interested in the way people behave and the way the brain works. Specifically, I think psychosis is fascinating. Treating patients with psychosis is almost being like a detective. Patients can have very deep-rooted delusional ideations, they can have hallucinations, and it's your job to figure out exactly what is going on, what is that patient's reality, what are they experiencing, and then from there, try and help them with those experiences. Sometimes superficially, people can appear as if they don't have any delusional ideas, and there's always kind of an air of normalcy to their stories. How it's really when you start going into the details of their stories that they start to unravel. I just want to caveat this point by saying, of course, for a patient, being psychotic is incredibly stressful, it's incredibly traumatic, and it's an incredibly difficult part of their lives. This is something you always have to bear in mind when you are speaking with people who have certain hallucinations or have certain delusions, is that for them, what they're going through is very, very real. If they think the government are after them, for us, it may not sound that serious because we know that's not real, but for them, they truly believe they're being persecuted by someone or something. They believe that with as much conviction as I believe I'm sat here right now. Moving on to point 3 is teamwork. One of the biggest things I really enjoyed in my foundation years was working as a team. Whether that was working with other doctors, more senior doctors, pharmacists, nurses, or any other health professionals, I really enjoyed that team aspect of things. Psychiatry is a very, very MDT-led specialty, with lots of healthcare professionals and non-healthcare professionals all involved in a patient's care. Whether that's working with community housing teams to get a patient appropriate support once they leave the hospital, whether that's working with pharmacists to devise particular treatment plans, or working with nurses to really help with the patient's behaviour while on the wards. I find the camaraderie of working in a team really enjoyable. They're the main things I like about psychiatry as a subject matter or kind of as a specialty. But there are certain things, like I mentioned before, that I like about psychiatry as a career in the NHS or in the UK. One of the big things about psychiatry is the training program. Now, I know a lot of the other complaints trainees have on other training programs is a lot of it is service provision and they're kind of doing things just to cover gaps in rotas and things like that. I found that in psychiatry, it's a lot less of that. I've also found that psychiatry training is very, very supportive. Every week for the first year of psychiatry training, we have something called Balance Group, which is kind of a reflective process. You can bring difficult cases or difficult things that you've been through to talk about. We also have weekly hour-long sessions with our consultant in which we can talk about anything that we want to do. It can be about patients that we've seen, it can be about workplace-based assessments, it can just be about things that we've been finding quite difficult or we want to ask for advice. There's so much support available for people that need it in psychiatry training, and this is something I think a lot of the other training programs could really learn from. I've also found as a specialty from speaking to consultants and more senior doctors that psychiatry is a lot more flexible than certain other specialties you'd find in the NHS. So guys, those are the things I really love about working in the UK in the NHS as a psychiatrist. If you want to find out a bit more of my journey into psychiatry, just click here now.